Thank you everyone for your attendance today. My name is Nicole Orlino. I'm an admissions officer here for the online programs of applied learning at Johns Hopkins University Bloomberg School of Public Health. Today we'll be discussing our population health management program. Joining us today will be the director, Mark Bittle of the Population Health Management Program, Hiren Prabhakar, one of our graduates of the program, and myself. My name is Nicole Orlino. I'm an admissions officer. I work with our team to assist students as they explore their options for continuing education. I am very excited to be presenting with these two today. Mark, I'll let you introduce yourself first.
Well, thank you everyone for joining, and thank you, Nicole, for coordinating this session for today. My name is Mark Bittle. As you heard, I'm the program director for the Population Health Management Program. I also direct the Master's in Health Administration program here at the School of Public Health. I'm a full-time faculty member in the school and the Department of Health Policy and Management. I spent 35 years of my career before joining academics full-time as a healthcare executive, primarily in the ambulatory and physician practice space. So a great deal of interest and experience in community-based primary care, specialty care, and essentially community medicine. So it's a pleasure to be here today.
Thank you, Mark. Hiren, if you'd like to introduce yourself.
Hello all, this is Hiren Prabhakar. I'm currently with Advocate Aurora. I work as a project manager within the Enterprise Population Health Division.
Thank you, Mark and Hiren, for your introductions. To give everyone an idea of what we'll be covering today, Mark will take us over the industry overview, really discussing why there was a need for the specific program and to give you an idea of who the program is targeted towards. He will also be going over the program details and curriculum to give you an insight on what skill sets you'll gain and what sets our curriculum apart from other programs. Our program is fully online, so Mark will give you an idea as to what online learning is like at Johns Hopkins University. He will go on to discuss some of the program faculty, and then we'll hand it over to Hiren so he can share his experiences as a student in one of our programs. As for myself, I will go into admission requirements, tuition and financial aid, and details about the scholarship we offer. We will save some time for Q&A at the end, so please feel free as you listen to the presentation, type out any questions you have into the chat box, and we will cover those at the end with Hiren and Mark. Thank you so much for your time, and Mark, please feel free to start.
Great, well, thank you. So I'd like to just set the stage for why the Population Health Management Program not only was developed going on 5 years ago now, but why I think it's so relevant today, even more so than 4 or 5 years ago when it was one of the first in the country. You know, as we think about the changes that are necessary in transforming healthcare today, one of the things that we continually go back to is kind of how fragmented, how costly our healthcare delivery system is in this country, and juxtaposing that against the outcomes that we see. So we spend far more than any other developed country, and yet our outcomes rank us somewhere below the median of these very same countries that we compare ourselves to. And even within our own states and our own zip codes in our states, we see great disparities in care, great variability in the outcomes of care, longevity. In one zip code in Maryland is 20 years less than the average in the state. I mean, it's less than some undeveloped countries. So there's great variability in care. The outcomes aren't what we want them to be. We're spending a considerable amount of our gross domestic product on healthcare, somewhere in the neighborhood of 18%, $3 trillion. And it's expected to go up to $6 trillion in just the next 4 or 5 years. So we really need to be thinking about how do we make healthcare more affordable? How do we make the outcomes more in line with what we're looking for? And really be thinking more broadly about health in the broadest sense of health improvement, and not just health care, the medical care component of it. So as we think about, you know, the changes that we've seen as the result of many payment reforms, the Affordable Care Act being the most recent in 2010, a lot of those efforts have really been around changing how we pay for the care in the United States. And part of that is because we've seen over time that how we pay for care influences the kind of care that we deliver and the kinds of outcomes that we receive. So this notion that we're moving away from a volume-driven type of payment methodology related to fee for service that really encourages utilization, and not just utilization, but oftentimes utilization of low value services, to this notion of value-based payments and value-based care delivery. What does that mean? Well, what it means is we're trying to tie the payments for these services to the outcomes of the service, not just tying the payment for doing it, but for doing the right thing to get the right outcome. And so we're now linking payments more explicitly to performance with the intent of aligning incentives within the provider sectors of medical care to provide more appropriate care, to provide high value, low cost services, as opposed to looking at those low value, high cost services. And that shift, as I say, has been occurring now really over the last decade since the Affordable Care Act was passed, and I think has been accelerating even more so in the last 5 years. But most of that focus has really been within the four walls of the hospital or the health system. Value-based care, to be successful as a hospital or health system, you focus on two key things. One is integration, and the other is care coordination. By focusing on integration, you're able to reduce the per capita spending to improve your efficiency. And that's really connecting the dots across these horizontally and vertically integrated healthcare delivery systems, so that they're able to function more efficiently. The other side of that coin is then care coordination, and this is really where the quality of the care, the safety of the care, the experience of the care comes into play. By not only connecting the dots, but having these various components of the care delivery system focus on the patient, being more patient-centric, allows us to deliver higher quality care, and tying the payments to the outcomes creates an alignment of incentives around improving care delivery. Um, but that's really this idea of how do we make health systems more efficient and effective, and that to me is the notion behind value-based care. But if we think about health in a broader sense, so value-based care, I think, is really about improving medical care delivery. Um, Population health is really about improving the health of the community as a whole. It's not just the patients within your health system, but everyone who lives in and around the community that you serve. So it's taking this idea of being more efficient, more effective at care delivery, and really allowing us to transform health systems into health platforms, to be able to think outside of the four walls of their hospital, to improve health, to improve functional status, to address the social determinants of health, because those are the real drivers behind poor health and the chronic conditions that we are going to be spending nearly 80% of our healthcare dollar treating in the future. So the population health management program, as I say, was developed about 4.5. We're getting ready to admit our fifth class of students. Um, and it was pretty much ahead of the curve at that time in terms of being one of the only programs out there to offer a master's degree in population health management. And so our intent here is really to take the best of our school, the School of Public Health, and marry that with the best of what we know to be evidence-based healthcare administration and management. Bring them together, build that bridge between public health and healthcare to create this population health management program. Next slide, please. So as I say, one of the goals here of the population health management program was really to think about what's next, what follows value-based care. Value-based care and developing value-based delivery models is still incredibly important for our health systems to be focused on. Again, I think that's really the essence of what healthcare systems can do to enhance value is to adopt these value-based payment models and really think about transforming into value-based care delivery systems. But that's the medical care side of it. How do we now think about those social determinants of health, those factors that influence health more than just what medical care does? Many studies have shown that 80% of poor health relates to factors outside of the control of the medical care delivery system. They may be effective partners, the health systems, but they're not going to be the sole source of solving these social determinants. So it really requires a different set of skills, a different set of competencies, and a different mindset, even for healthcare administrators or physicians, providers in a variety of roles in health systems, a different mindset to be thinking about health in this broader sense than what we've traditionally focused on as a delivery system. So what we've done in this population health management program is really create an interdisciplinary experience for professionals. So the students that we attract are students who are in healthcare delivery systems. They could be in pharma, they could be in public health organizations, community-based organizations, really to bring them together for an interdisciplinary experience around population health. So it takes the best from our international health colleagues, our health policy and management colleagues, our biostatistics and epidemiology colleagues, our community and behavioral health colleagues in the School of Public Health, and marries them with executives who are working full-time professionals in many cases, who are teaching sort of the healthcare side of it. So it provides a view of health from both lenses, public health and healthcare delivery. And so our curriculum is really built around giving you a very good, not only broad, but I think deep understanding of what the important elements are in a population health management strategy so that you're able to take these in a very applied way. And I'll talk about that in a little bit, and I'm sure you'll hear some of that from Hiren as well. But one of the goals of this program, because it is focused on working professionals, is that we wanted it to be applied, that we wanted you to be able to take one of these courses and listen to a lecture or do a reading or work on an assignment that you're able to then take back to your workplace and do something with the very next day. And one of my favorite parts of being the director is when I get an email from somebody saying, I'm working on this project and I listened to your lecture last night and this is exactly what I needed to be able to fill in the blanks. And I get emails like this at least once a week from our students to say how applied and practical what we're teaching them is in relationship to what they're doing today to construct these population health management strategies. So as I say, if you look at the bottom of the slide there on the left are the core functions of public health. We have the triple aim, of course, on the right-hand side, better care, lower costs, improve health, and looking at how we can bridge those two in a meaningful way to give our students the skills and the competencies they need to be successful as population health leaders. Next slide, please. So we've built this program again around working professionals. Our goal is to target individuals who are at the cusp of or in the midst of leading the transformation in their organizations to a more population health oriented focus. I mentioned that I spent 35 years of my career in healthcare. I'm board certified as a healthcare executive. I'm a fellow in the American College of Healthcare Executives. Did a lot of work in the ambulatory and physician practice. And in my last several years in that field before joining the School of Public Health, we were doing a lot around, trying to reduce our readmission rates from our emergency departments. And we were recognizing the impact that social determinants of health were having on those readmissions and that there was only a limited amount of what we could do to influence those readmissions. There were really things that were happening in the community or structures that were lacking in our communities that were driving a lot of these readmissions. And we just didn't have the skills and competencies to address it. We really needed to figure out ways to partner with those in the community that did have the skills and competencies. So this program is really targeted to helping people understand what population health is and giving you the tools and skills and competencies and confidence, through the various cases and work that you'll do together in the program to be able to develop your own population health approaches in your own communities. As we think about population health, we recognize that it's all local, right? What you do in your community is based on your community needs and the resources that are available in your community to work on those needs. So as I say, we are focused on clinicians, managers. We have hospital presidents in our program. We have pharmacists. We have social workers. We have nurses. We have physicians. So all likes of students, mostly from the healthcare profession, but we also have individuals from other sectors of the healthcare industry, like pharma, like public health departments that are there. We just did an alumni survey. The school just did an alumni survey. I got the results actually earlier this week, and it was very encouraging because among our population health alumni, the median salary is $112,500, and 75% of them are working in a position now directly related to population in some form or fashion. And we've listed some of the, and there's just a myriad number of titles out there, be it vice president of population health. You could be the president of a hospital that's working with your board to redirect or reimagine what your role in a community health or population health environment is going to look like. Director of Healthcare Integration, Chief Integration Officer, Chief Transformation Officer, Director of Community Health Operations, Director of Community Outreach. I mean, any number of titles, but many of which have some role, if not a primary role, in helping to not only craft the strategy around population health, but to execute on that strategy in meaningful ways. So there's a quote there that you could see at the bottom of the slide, where again, one of our current students was able to draw upon knowledge that they gained in the course, and the assignments that we give are very applied, very practical, again, very real life. And so she was actually able to draw upon that for an interview that she was in. And we've had any number of again testimonials from students that share with me that they got a job. One of our recent graduates is working for a large healthcare company right now, and her promotion was directly related, as she stated in her own words, to having completed this program, and she's a senior vice president now. So again, we're very proud of our students. They come to us with a tremendous amount of knowledge and experience to start with, and we work together to sort of enhance, to tie those things together in a meaningful way, so that they're able to be successful in their jobs. Next slide, please. So before I go into the program details, I just again want to emphasize this notion that we have an interdisciplinary faculty, whom I'll share some of the names in just a bit, who have come together to develop this program that's focused on bridging the public health and the healthcare side of things into this focus on developing a population health approach and management strategy for your populations, your communities. But I think one of the other key things to this program, and hopefully Hiren will mention this as well, but is really the students. So again, our students come to us. They have experience in healthcare. They're already in many ways engaged in some of these things, or wanting to be engaged in some of these things in more meaningful ways. And the way we've structured the program, that even though it's an online program, you will be doing group work, and you will be getting to meet and know your colleagues that are in the program. And we firmly believe that that's one of the benefits of the way we've structured the program, because you're able to not only learn from us, we're able to learn from you, from the insights that you bring into our class discussions and into your assignments, but also learn from each other. We have students from across the country. We have international students that participate. We have students from Canada, the UK, and working in the NHS, for example. And so everybody brings these different perspectives, these different insights that makes for just such a rich conversation, a rich discussion. Again, people think about online as being this static thing that I listen to a recorded lecture. and there's very little in the way of interaction. But in fact, it's really a very dynamic um, program where you get to work closely with colleagues. And as you go through the various classes, you'll get to meet and know your colleagues very well. I'm amazed at how well our students know each other by the end of this program because of their ability to work together. So let me just focus on some of the program details. You have the ability to enroll in two ways in this program. First, you can enroll in the certificate program. Um, if you're just looking to add a certificate, maybe you already have a master's degree, maybe you're not sure and you just want to kind of get your feet wet back into school again after some time. The certificate allows you to complete one academic year of courses, so that would be 8 courses. You have up to 2 years to do it part-time, which would be 1 course per term. Our school operates in a term on terms as opposed to semesters. So they're 8 weeks is a term. So term 1 is 8 weeks. Term 2 is the next 8 weeks. There's a break in January. Term 3 starts at the end of January and goes for 8 weeks. Then term 4 starts for another 8 weeks and ends up in May. So you can take 2 courses per term or 1 course per term for the certificate program, or you can apply to the master's program directly. The master's program is designed to be completed part-time as well, so you would have 4 years to complete the master's program. That would be 1 course per term over a 4-year period, or you can complete the master's degree in 2 years by taking 2 courses per term. If you enroll in the certificate program and decide at the end, gosh, this is really great, I'd love to go on and get the master's, you do have to reapply in the sense of filling out paperwork to say you want to do it, but you would be automatically admitted, but you do have to reapply. In the master's program, at the end of the first year, once you've complete that first year's coursework, you automatically earn the certificate, so you will get that automatically, and then go on to complete the master's degree. So again, essentially there are 8 courses in the first year of the curriculum, and there are another 8 courses in the second year of the curriculum. A total of 16 courses, 50 credits to get your master's degree. This is very much an applied program. I can't emphasize that enough. It's designed that way purposefully to give working professionals, in a sense, just-in-time information. These courses are kept current. We're focused on contemporary issues. We're forward-thinking in our curriculum as well, as we think about adding new content and making sure that we're providing you, the students, the professionals, with the information that you need to be successful. So we really pride ourselves on the applied nature, the ability to take this and use it. I did my master's degree at night while working full-time for a hospital. It was probably the best thing I ever did. I would go to school at night and I would be able to bring things back to from class to my work the very next day. And I learned, I think, so much more as a result of that. So I bring some of that experience. I did my doctorate as well part-time while working full-time for a health system. And I got my doctorate here at the School of Public Health. So again, I appreciate the value of what it means to work, have a family, go to school at night. Not only in terms of your time, we treat your time with a great deal of respect, but also the value that brings to the education process and the importance of being applied and applicable. So again, it is part-time. It is designed to be a part-time program, 100% online. All the courses are online. There's no on-site elements to it at all. As I mentioned, as we've designed our curriculum and our courses, it's really around this idea of group learning, that we're learning together, but you're also learning from each other. There are opportunities for peer assessments in the sense that, again, having the opportunity to bounce ideas off of each other as you're contributing to these projects. And the cases that we've built into many of these courses, as you saw from that example from one of our current students, where she was able to take one of these cases that she was working on and actually incorporate it into, her interview for a job. So these are real life things that you'll be working on, that are very applicable to what you would be doing in your, in your jobs around population health. So our goal here is really to develop public health, population health, excuse me, professionals, that that really understand and are able to advocate for this idea of population health and for a population health management strategy. We want people that can be out there representing what population health really means, using the evidence to then apply it in the construction of a population health management strategy. We want people in our program that desire to be thought leaders, that aren't just going to be, listening to what we have to say and sort of regurgitating that back through assignments, but really taking what we have to say and saying, that's really helpful, but it's the starting point to our ability to now make change and influence in an organization. So we want people that are going to take what we tell them, not just as gospel, but really as the starting point for transformation in their own organizations. It's like planting the seed. You have to, you have to be willing to work at tilling the soil and watering it and feeding it in order for it to really develop into something. We're really looking for people that are willing to exchange knowledge. So we want people that are going to be willing to share with each other, willing to share with us. One of the things that I do in all of my courses is there's a place for you to contribute articles or books or videos that you've seen that you think would be important for us to learn about together. So we're looking for you as much as you're looking to us, for guidance. So knowledge exchange is really important for us as we think about the kinds of students that we're wanting. And then also people that are really going to be agents for change in their organization. Again, not only to be able to advocate, but also to be able to execute. So it's one thing to be able to understand enough to talk about and advocate for something, but we also want people that are willing to roll up their sleeves and make a true difference in their organizations. Next slide, please. So this is the year one curriculum. You can see there are, in term one, there are a couple things that you have to take that are required. So the academic and research ethics is required for any student in the School of Public Health. We have an essentials of population health management, great starting place, right? We have principles and applications of advanced payment models, of course, that I developed and teach. That again, in the beginning of the program, to give you a sense of what's happening in terms of how we're paying for healthcare today, how that is evolving, and making a case for why it's insufficient, and what we need to do in order to develop a true population health management approach. We have a course in term two on collective impact, again, recognizing that to address social determinants, you're not going to be able to do this by yourself as a single organization. No single organization is going to be able to do it. Even a large, system like Aurora, they're making tremendous impacts in health in their communities, but they're doing it through partnerships in many cases. So this course talks about how to do partnerships effectively in the community. We have a course on that looks at quality and effectiveness. So we're for those of us who work in hospitals and health systems, we're quite used to the vernacular of quality and patient safety and the metrics associated with these things. But as we think more broadly about health in a community, we have to broaden our understanding of what the measures of success might look like and how to measure them. And in many cases, we have large health systems that aren't really measuring functional types of health status measures in their community beyond what they're needing to measure for their health system. So this, again, gives you a broader sense for what's out there. I'm not going to go through each of these individually, but you can see we talk about population and consumer health informatics, so understanding how to take data, analyze data, stratify data from a population health perspective, which is so critical. Some of the basics that we think are very critical to understanding how to use data and work with data. So we have an EPI class, we have a statistical concept, so understanding the biostatistics. so that you can actually demonstrate and prove that you're making the improvements that you want. And then we end the fourth term with managing health across the continuum. So again, I talk about this idea of care coordination within health systems. This is now looking more broadly in terms of how do we manage care? How do we manage health across a spectrum? And this is really related to the health risk pyramid. So you have all these healthy people in your population. What are we doing collectively to assure those people stay healthy, right? What are we doing from a lifestyle management perspective to keep these people healthy so they don't work their way up the health risk pyramid? Next slide, please. So that leads us then into year two. So if you complete, again, the first year, you earn a certificate. You can enroll in that specifically, or you can enroll in the master's program, in which case you would move into the year two of the curriculum. These are our higher level courses that we've designed to look again at more specific aspects of a population health management strategy, both thinking about it from the health systems perspective, but also thinking about it from outside the four walls of the health system. So applied concepts and foundations of high performance. So we leverage this notion of high performing organizations, but we apply it to a population health concepts. We look at health behavior. Again, behaviors. One of the biggest drivers of the social determinants in poor health are our own lifestyle behaviors. So as I mentioned earlier, what are we doing to address these lifestyle behaviors to change behavior in our communities? Organizing for public health, again, a systems oriented thinking class. So how do we think systematically about our approaches? Again, it's looking at how do we connect these multiple pieces in our communities to be effective, as opposed to having all these siloed efforts that are making limited impacts. Value-based payment methods. So this is a behavioral economics course. Again, thinking about how do we use economics, how do we use incentives to change behaviors, not just health behaviors, but lifestyle behaviors that impact health. We have a course on the built environment. So again, understanding how where you live, the zip code that you live in, could very well influence your health. Many health systems now have community initiatives around housing and being able to support low-cost affordable housing in their communities because of the link between housing and where people live and their health. And then finally, we have a leadership class. So this value-based concept, socially responsible leadership, talks about this notion of what a socially responsible leader looks like, this idea of thinking outside the four walls of your hospital. How do we lead collaboratively, through a network of collaborators to improve health? We have a community and primary health program course that really looks at the social and cultural aspects of health, particularly around primary care, prevention, and wellness. So critically important, such a missing element in many health systems today. And then finally, the integrative activity. This is really the culminating event. It's the capstone, if you will. All master's programs require a capstone of some sort. This is ours. We call it an integrative activity. It allows you to take what you've learned throughout the entire program and apply it to a particular case and allow you to demonstrate the values, what you've learned, but also to pull from outside your own experiences to address developing a population health management strategy. Next slide, please. So I'm just going to quickly go through this. The School of Public Health has been doing online learning for quite some time. I mentioned this program is going on 5 years old. Each year we've made some iterative changes to the program, not only to keep it contemporary and current, but just to address the feedback that we get from our students. Again, I love the engagement of our students. I hear this from faculty all the time when they compare our population health management online students to some of the other students that they teach in our school, how engaged, the level of engagement of the individuals in the MAS in population health management program are just incredibly engaging. And again, we use that engagement to our advantage to really learn from you, not only about concepts and theories, but and how applicable or not applicable they might be, but also in terms of just how to deliver the concepts and the learning in a means that's most effective. So just to give you a very simple example, the faculty that teach in the first term of the program communicate with the faculty that teach in the second term of the program. We want to make sure that, if you're doing group work in second term, we might not want to do group work in first term, right? Because we don't want to burden people with doing these myriads of groups and trying to keep track of being in 4 different groups to deal with 4 different classes. So we actually communicate as faculty to say, what are you doing in your class? What readings are you giving, so that we're not giving the same readings, that we're not, again, wasting your time by reading the same article 12 times. So we do a lot of coordination from term to term between courses, between faculty, to assure that we're providing you with high value education, but one that recognizes and respects your time as part-time students. All of our faculty are either full-time like myself, but have come from a healthcare background, or that are working full-time in the healthcare world, for instance, running an ACO, accountable care organization, and teaching a course for us. So again, we have I think a really nice blend of interdisciplinary faculty looking at cross disciplines. We have physicians that are teaching in our program, nurses that are teaching in our program. We have, again, executives that are doing this full time, teaching in our program, as well as people who, like myself, were in the business and are now, looking at this from an academic perspective. 24/7 help desk. So if you ever have issues while you're taking your course, again, faculty are there when you're taking their course to be the resource, but if you have technical or other broader issues, there's always someone to turn to 24/7. Next slide, please. So very quickly, I just want to give you a picture. This is actually the course that I mentioned that I teach, Principles and Application of Advanced Payment Models. This is what it would look like on the home screen, if you will, if you're a student. Next slide, please. What we've done is lay out our courses so that everything is in this course site for you. It's all laid out. It's easy to find. We've tried to be standardized across courses so that you always go to the same place to find the same thing, so you're not having to relearn for every course that you take. So here's, an example of the syllabus. It lays out everything that you need to know about the course. You can see the tabs across the top right there. The syllabus is in the dark blue, and then you see content to the left, to the right of that, communication, resources, help. There's a help button. So each of those allows us as faculty to organize things, allows you as students to easily and efficiently find what you need to do. Next slide, please. Course schedule. Again, everything is laid out for you. You know exactly when the material becomes available, exactly when all your due dates are. This can be easily printed out. I tell my students all the time, print it out, tape it to your refrigerator, tape it on the mirror in your bathroom, tape it on, your calendar at work. Again, wherever it is that you are often looking, whether, it's the calendar on your refrigerator. But again, everything is loaded right here. So it's one-stop shopping for everything you need, whether it's readings, listening to the lectures, looking at what the assignments are. It's all there and very easily accessible. Next slide. This is an example of another, I mentioned the community-based primary healthcare class. So this just gives you an example of what a particular lecture page would look like. So in this case, it's lecture 2. You can see the learning objectives. To the right under lecture materials, those are the recordings for each of the lectures. It's available for you to download. So you can either click on it, listen to it right there. You can download it to your computer and listen to it at some other time. At your convenience, listen to it in the car while you're driving if you want. And you also have the ability to download the transcripts. So you not only get the video, but you get the actual words behind the lectures. Again, some people like that. It's easier to study from, perhaps. But again, it's all there and embedded on each lecture page. Everything you need for that lecture is on that page. And it's the same across all the courses. Next slide, please. Again, just an example of assignments. Again, very easily, very efficiently organized, easy to follow. You can see on the right-hand side, it says online library. Everything you need to know about that particular assignment, associated readings, etc., are right there. All you have to do is click on them. And so again, we've tried to organize this to be as efficient for you as possible. And a lot of this has evolved from student feedback over the years. So again, it's been helpful to have that level of engagement. Next slide, please. So again, just an example of our faculty that are teaching. Dave Baker, just for an example, is a senior director for population health in the health system that he works in full time. He's been worked for CMS in the Center for Medicaid and Innovation, so in the Innovation Center of Medicare. So again, a lot of experience around quality. He teaches the quality course. That was sort of his background. He did his DRPH in quality and patient safety. A number of individuals, Ashwini Davison's a physician teaching for the program. She teaches the essential course as well as the Care Across the Continuum course. Doug Huff, economist, behavioral economics class. Megan Priolo just recently got her DRPH from the school. She ran an ACO for a large health system and is now working for a health information exchange as their senior director of population health. And so she teaches the socially responsible leadership course with me. So again, a broad range of individuals. Catherine Moon's our most recent. She's in the International Health Department, and she teaches and developed the Built Environment course. Great course, and we're happy to have her participating. So again, a broad array of faculty from multiple disciplines, both full-time faculty as well as part-time faculty who are working in the business. Next slide, please. Well, so great. I'm going to turn it over to Hiren now. You've heard enough from me. I think it's great to hear from one of our alumni who've been through the program.
Thanks, Dr. Bittle. My name is Hiren Prabhakar. I graduated last year from the Master's in Population Health Management program. Interestingly, as I was thinking about where I was last year, it was fascinating because we were just about almost done. We had about 2 courses left. And as we all know, the world, as we know, changed. Right. And it was very fascinating because everything we had learned up until that point, everything we had discussed and exchanged ideas about up until that point, stuff like social determinants of health, health inequity, syndemics, was unfolding before our eyes in real time. So it was definitely a very interesting time last year. So a little bit of a brief background on me. I originally started out in the technology sector over 12 years ago. But I was volunteering for a community organization that was focused on integrating individuals with disabilities into the community. So as part of my experience with that, I realized how important social care, how important community was to an individual's development within the community. So that's what sparked that curiosity, that passion in me to get into healthcare. And 12 years on, I'm currently working for Advocate Aurora Health here in Chicago. Don't let my background deceive you. I'm not in the Bay Area. I love the Bay Area, but I'm currently living in Chicago. I work with the Enterprise Population Health Division at Advocate Aurora. And in my current role, I lead and manage initiatives for our accountable care organizations, our clinically integrated network, as well as our MSO. Many of my projects span across government programs, value-based care programs, also in terms of integrating many sources of data all across our system, as well as outside as well. I also serve as a population health advisor to many of our teams at the system level. So I bring in a pop health expertise, the pop health advisory role to many of the strategies that are implemented at a system level. Next slide, please. So before I applied to the Johns Hopkins Masters in Population Health program, I realized how just the opportunity to be part of a very highly reputed, highly distinguished academic and research community was just so important, just a huge honor to be part of that. And at that point in time, there were very few such population health focused master's level programs. So that was a huge factor in my decision at that point in time, and I still think it's one of the best decisions I've made up until this point. Also, the ability to connect what I was working on in my current role and what I was learning in terms of research, in terms of exchanging ideas with students as well as with faculty, just to connect and bridge those two worlds was so important to me. And I feel like that I definitely accomplished that. And also the virtual model, definitely huge boon in terms of maintaining that work-life balance. And as we all know, the virtual model is here to stay. We've all been more or less used to it by now, ever since COVID hit us. Also, I would say definitely in terms of the program faculty, a very diverse set of backgrounds, both in academia as well as in the industry. So it was very fascinating to be able to hear from thought leaders, hear from individuals in the industry as well as from academia. And that also kind of overlapped with students as well in the program. As Dr. Bittle mentioned, the exchange of ideas with other students in the program. Many of them are experts themselves in the population health or healthcare field. So to be able to engage and interact and exchange ideas with them was amazing, because even though we were all virtual, we still had virtual collaboration that was very strong. And interestingly enough, just a little bit of a tidbit, we had an informal virtual reunion just a month or two ago. So that that virtual collaboration was so important, was still, I would say in many ways, replaced an actual in-face collaboration as well, because you could actually discuss ideas with someone who was in a different country or different part of the world and understand their experiences as well. Next slide, please. So in terms of hints or tips for success, I thought about it quite a bit, and I just distilled it down to 4 or 5 points here. But I would start off with definitely, I mean, working and studying part-time, it can be a bit of a challenge. But if you're judicious with your time, if you can cut out the waste, you may have to say no to a few things, but if you can be strict with managing what you say yes to, it actually becomes quite feasible in being able to balance your personal life, your work life, and your school life. And at least that was my experience. And I found that especially being able to connect the dots between my work life and my school life, and actually my personal life as well. Ever since COVID hit, we all know how much healthcare, social care, and all those different items have become part of our personal lives as well. In addition, I would say definitely having your workplace or your employer encouraging you in terms of your aspirations is a big advantage as well. This one, the third point there in terms of the hardest concepts or classes, that's an interesting one, because to me at least, the hardest classes ended up being my favorite ones, because those are the ones I really had to think about, really had to think through and see how it related to me, related to the world around me. And I ended up really enjoying that process. So I would say definitely don't be dissuaded or discouraged when you encounter a hard concept or a difficult concept, because that's when you really have to put your thinking hat on and see how it relates to you, and might end up being your favorite concept or class. And that again relates to the next 2 points there about thinking relationally. Think how different concepts, how different worlds, how different ideas or courses relate to each other, and just open yourself up to fascination, because see how it relates to your world, see how it relates to the world around you and to the people around you. And that can be an amazing, illuminating experience by itself. Next slide, please.
Thank you, Mark and Hiren. I am now going to take some time to go over the admissions requirements. All of our applications are processed online through Sophus and Sophus Express to streamline your application. For our master's degree, the application is done through Sophus, and our certificate application is done through Sophus Express. The requirements for education are a minimum of a bachelor's degree from a regionally accredited college or university. The professional requirement is a minimum of 3 years of health-related experience. We do require a current CV or resume to be uploaded into the portal. The letters of recommendation requirements are 1 for the certificate and 3 for the master's. The statement of purpose is going to be a big part of your applications. This is where you'll be able to communicate to the admissions committee why you are pursuing this program, what you hope to gain, and really what your ultimate career goals are. For our international students, if English is not your first language, you may need an English proficiency exam. We do accept either the TOEFL or the IELTS. For those who have obtained their education outside of the United States, it is a requirement that you undergo a course-by-course evaluation through World Education Services. We do encourage you to start this credential evaluation early to gather any required documents and to make sure that that evaluation is done in a timely manner. Looking over the admissions information, our applications are reviewed on a rolling basis, meaning you do not need to wait until the deadlines posted on this slide to hear back from the committee with your decision. Our applications are now open for the fall of 2021. We do encourage students to apply early so you can receive your decision earlier and start preparing for that upcoming term. The deadline to apply for the master's is going to be June 1st, and the certificate deadline is July 1st. We do only enroll once a year in the fall, so this is important to know if you are excited about this program and are ready to go ahead and apply. To provide an insight on the kind of investment you'll be making, we've listed our financial information here, as well as some information about the financial aid office. Pending board approval, the current school year tuition rate is $1,233 per credit. We do offer a partial Opel Scholarship that covers $474 per credit, which leaves students responsible for the remaining $759 per credit. This scholarship is specific funding to our Opel programs, which is our online programs of applied learning. If you are admitted into the program, you are automatically awarded the Opel Scholarship, and there is nothing additional you will need to do in order to receive it. So if you are planning financially, you will want to plan for that $759 per credit at the current tuition rate. Of course, keeping in mind our tuition rate and scholarship are reassessed each spring, and any changes, of course, will be updated on our website. And as promised, so we have saved some time for a Q&A, of course. And so I'll go ahead and direct any questions to Mark and Hiren. So first question, if someone does not have a previous academic background in public health, are there any classes you would recommend to prepare for courses in the program?
So you don't, you don't, again, this is designed so the simple answer is no. If you've not had public health courses in the past, that's not a distractor by any stretch of the imagination. Again, we're typically, our students are coming from the healthcare field, so they understand healthcare, the concepts of public health that they need to know, we teach them. The only thing that we do look for when we review the applications is your quantitative capabilities. We don't require the GRE, so there's no standardized test for us to look at, but we do look at your transcripts. Again, you may have gone to undergrad, 15 years ago, and you're coming back to school for your master's degree, or you've gone to school, for your undergrad 5 years ago. But we do look at the kinds of quantitative courses that you've taken. The further back in time those courses were taken, we tend to then look at what your current experiences are, what you're doing in your day job, in terms of the quantitative skills that you would be using. And that's really around the biostats class that we offer in the program. We do have, for those students who are concerned, now biostats is until the fourth term of the first year. So there's plenty of time for the student to take to use some of the resources that we make available. If you want to brush up on your biostats, if you want to do some practice work on biostats just to get a head start. So for students that may have some concern about that particular course, we have resources that we can share with you to prepare you for that. But outside of it, no, there's no other public health things that you need to come to the table with.
Gotcha. Thank you, Mark. So are you able to discuss an example of the integrative activity?
So the integrative activity for this year is a standardized case. So because not all, in order to make it as efficient as possible for our students, rather than having you find your own case to do, we've prepared a standardized case based on real data for a real community around a real issue that involves both the public health side of things as well as the healthcare delivery side of things. And you're asked to essentially put together a population health management strategy to deal with the issue, primarily the primary issue, but also the surrounding issues. Again, we talk about social determinants. What are some of the drivers that are impacting the particular thing that you're being asked to talk about? To really put together, again, a population health management strategy that allows you to draw in and use a lot of the concepts that you've learned throughout the variety of classes. Virtually every class that you've taken, every course that you would take, would contribute in some way to the solution of this case, as well as bringing in experiences and evidence from other places.
Perfect, thank you. I'm residing in Canada and wondering how many international or Canadian students there are. How relevant would these concepts be for my learning and applications?
So that's a great question. I think every graduating class since the beginning, we've had someone from Canada in it, in the program. And I think the concepts of population health are as applicable in Canada as they are here. To UK, we've had several students that work for the NHS, and they're all very anxious to understand population health. We have a student in Mexico right now. Again, I've traveled to China, Saudi Arabia. I've talked with people around the world. Virtually everybody is addressing the same issue we are in terms of escalating costs for healthcare delivery, having to think outside the four walls to address the social determinants, the real drivers of poor health. And so everybody is thinking about how do we adopt a more population health oriented approach in our country.
Would like to add to that as well. I'm actually from Canada as well, so definitely I would say many of the concepts that are covered as part of the program are relevant to healthcare in Canada as well as elsewhere. And a lot of the ideas, some of the initiatives that are rolled out in different provinces in Canada might also be relevant to some of the discussions or exchange of ideas among students as well in the program.
Perfect, thank you. What is the average amount of hours per week spent on coursework?
So I'll give you the academic answer, and then Hiren can give you the practical answer. So academically, all the courses that you take, I think except for one, is 3 credits. Each one is 3 credits. Essentially, 1 credit hour is meant to reflect 3 hours of work. So a 3 credit class is essentially designed to be 9 hours of work. That 9 hours includes listening to the lectures, doing the readings, time that is allocated to working on your assignments or a quiz or whatever happens to be occurring in that particular week is all encompassed in that 9 hours. That's sort of an overall average. Some weeks could be 3 hours, some weeks could be more over a course of 8 weeks in one course. But that's essentially what you could be thinking about from a sort of the academic perspective.
I would agree as well. I would say anywhere, if we were to look at 2 classes in a term, I would say anywhere between 14 and 20 hours for both classes. So depending on how much work is assigned for a particular week, or how much work is like, there could be a balance between both the classes. One week might be lean for one particular class, but heavy for the other class. So it could be, I would say anywhere between 14 and 20 hours for 2 classes combined.
And I would just go back to something I said earlier. We do work very hard among the faculty to coordinate so that if I'm teaching one of the classes in the term and Hiren is the other faculty teaching the second class in the term, we're talking to each other. You know, what assignments are you going to be giving? When are you going to have them due? We work very hard to make sure that you don't have 2 assignments due on the same day. one for each class. So we really do try to keep those things from overlapping. And also the way our courses, each lecture week is structured, the materials become available typically Sunday night, and are there and available to the following Sunday. So you have the entire week to organize yourself to say, oh, Tuesday, I have to work late Monday. Tuesday, I'm going to come home. I'm going to listen to the lectures, or I'm going to download the readings and start reading those, today on, Tuesday or Wednesday. So again, you have basically 7 days of that week to work on the materials that are assigned for that week. So it gives you some flexibility to really adjust and work around your schedule. There aren't fixed times and dates other than due dates for things.
Perfect. Thank you so much, Hiren and Mark. So I thank you all for your attendance today. If we didn't get to your questions, we will be connecting with you offline. Our team at the admissions office will contact you directly in the next few days to assist in answering your questions. If you do want to connect with someone immediately, my contact information is listed on the slide here. So feel free to reach out via phone or email. If you are excited about this program and see this as a part of your future, please feel free to use these scan codes here to move forward with your application. We do have our dedicated admissions team looking forward to working with each and every one of you through the process. So again, thank you, Dr. Bittle and Hiren, for your time today.
I want to thank Hiren. I appreciate our student for being here, and it's a pleasure to share the information.